everyone, it's Dr. Danielle Kelvis here. Here to just give you a little bit on genetic counseling. Okay, so genetic counselors and geneticists are rapidly becoming a vital part of the healthcare delivery team. Patients should seek genetic counseling if they suspect that a disorder or a disease runs in their family. Many genetic disorders can skip a generation, so collecting an outlining a detailed genetic tree is very helpful. An important distinction to make, though, in genes or alleles is to determine if the gene is autosomal dominant or autosomal recessive. And autosomal dominant just indicates that you carry a very high risk of developing the disease if one of your parents has it. It does not skip generations. So anyone that has the allele or the gene will get the disease. Autosomal recessive means that you have a slight chance of potentially carrying the gene. You may or may not express or develop those disease symptoms. If you have an autosomal recessive gene, then you can pass it off to your offspring. There's just a less chance than if it was like autosomal dominant. So genetic testing can be obtained through a blood or saliva sample. Typically takes 2 to 3 weeks to process, depending on where you get your lab done. In general, though, at the time of this writing or this recording, these tests are pretty cost prohibitive. They're very expensive. For example, routine testing for the BRCA1 and 2 genes for breast cancer and ovarian cancer. Last time I checked, the lab that I was working with my patients at the last practice was like $5,000 per lab. Now, if a patient has active cancer and if the test is ordered by your oncologist, usually insurance companies will pay for that if you are so blessed to have health insurance. Some companies are starting to offer more affordable testing, but it still needs to be ordered by a physician. There's been quite the advent and advertising of company to, or direct, company to patient advertising, and ordering labs kind of on your own is becoming more of a thing on social media. So I imagine genetic testing will, or I project it's going to, soon pop up on your social media feed that you'll be able to just order random genes if you want.